Scott County, providing safe, healthy, and livable communities.
Thank you, Mr. Chairman. Good morning, Commissioners. We are here today to report on a piece of the board's strategic plan that we have not updated you on before, and that is the strategy on promoting and expanding services to help residents lead healthy, active lives. We have a panel of folks that are primarily from public health and parks to talk with you this morning. I want to just set a couple of parameters for this quickly. This is not a conversation where we are telling people what to eat or telling them that they have to exercise. But it is about, you're just going to head off with your questions.
You could see me perk right up there, didn't you?
We are going to talk about access. That is the point of your strategic plan, was about access. So people have access if they choose to do these things. So we're talking about access. We're talking about a strong partnership model, both with across government organizations, but also with our nonprofit communities, and how we're providing these services. And we're going to talk a little bit about how some areas of this topic have been artificially inflated because of COVID, and others have been artificially deflated. And how do we navigate through that so we're making the most of the dollars that we're investing in these programs? And so with that, I'd like the facilitators to introduce themselves and what part of our organization they work for, and then we'll ask the panelists, maybe Patty, starting with you, to introduce yourselves, and then we'll get started.
Greg Sorensen, Chief Information Officer.
Paula Gustafson, Business Relationship Manager and Community Services.
Good morning, Mr. Chair, Commissioners. Danielle Fox, Adult Services Manager in Health and Human Services.
Good morning, everyone. Happy to be here today. Patricia Freeman, I'm the Programs Manager, or the Parks Program Manager, and I help manage our partnership with Three Rivers Park District.
Good morning, Alyssa Mitzvelt, the Park Strategic Programs Manager. Haley Misquick, Community Health Specialist with SHIP.
And Lisa Brodsky, Public Health Director.
And I will say, just as we get going, that Haley was a very last minute. She's filling in for someone who is ill today, so we really want to thank you for jumping in at the last minute. All right, Paula, you want to get us started?
I don't want to make it so loud here. Okay, hi. Good morning. When I started looking at these materials, one of the first things that you talk about is the importance of activity and having a healthy life. So I wanted to talk a little bit about your first measure that you have and the measure on page 8, which is about our activity levels or exercise in the last month. And I want you to be able to talk a little bit about the activity level that we're seeing is still around 47-50% within a week, but up to 78% over the course of a month. And I also show on page 5 that our access is so high in the county. The access to exercise opportunities is up to 91%. So I want you to be able to share a little bit about what you've done to increase that access. And I know it's been high over the course of the years. We had obviously COVID that dropped it a little bit, but now we're getting back up there. So can you talk a little bit about what you've done to help with that access to exercise and how you think that's impacted the activity levels of our citizens?
You want me to start off?
Yeah, a lot of the SHIP work actually is done in partnership with the parks. So
Sure. In terms of physical spaces, I think the county's done a really nice job jumping into the adding parks and trails in the community. I think, for instance, adding Cedar Lake Farm 10 years ago in an area of the county that really is pretty underserved in terms of public access to parks and trails probably had a pretty significant impact on that. I think that our cities, especially Belle Plaine, New Prague, their work in adding sidewalks and trails probably really impacts that as well. Yeah.
and we've done other activities, including partnering with some cities on safe routes to school to get kids walking more to school. A lot of summer programs for kids in need. The summer soccer programs at Esperanza, funding some signage, wayfinding signage, and worksite wellness programs that really focus on getting people at work more active.
I also want to add that I think that when people answer this survey question, just the perception that they have access to facilities probably really plays into that. And one of the things that we've been working on for probably 10 years is noting that there was really a lack of awareness, a persistent lack of awareness about our regional parks and trails in Scott County. So we really have been focusing on how do we change the dial on that. So, working with partners, working on, with media, increasing our recreation programming outside of our park so that people are aware of what we have. I would connect those two things a little bit as well. Do we know for sure if that's it? I'm not sure. But I think just knowing that you have access in your community probably impacts how you answer that survey question.
And on the flip side of your question, looking at any exercise in the last month or the past week, this data is from 2021. During 2021, we had a lot of gyms and facilities that closed. There was a lot of we had a lot of COVID in 2021. There was a lot of heightened awareness of COVID, and there was indoor recreation activities were reduced, although the parks did a lot of work to expand outdoor recreation activities. But again, like we're in Minnesota, it's cold in the winter. A lot of people don't go to the park to do outdoor exercise. But this is certainly an area of concern because we're way below the standard. We're also doing worse than the state and worse than the US. So we really need to do some more work in that area.
Could we, Lisa, the data that you were referencing, I believe, is on page 8.
Correct.
So if we could just, for folks on both sides of the table, just remember to help JJ with page numbers, that would help. So this is the data where you're saying we are
not doing as well
So on your teams, do you guys talk about that? Do you talk about, we have 91% access, but we only have 47% people that are being active every week? Like, how do you think about that gap?
Well, we have the Community Health Improvement Committee has a separate healthy eating, active living group, which is the county as well as our community partners, and we focus on having discussions about what are the gaps in our community. We do look at this data regularly because we do our community health assessment, and we have very specific objectives that we create each year after we look at the data for our community improvement plan, community health improvement plan. So it is regularly discussed. They meet quarterly, so 4 times a year, and we discuss different opportunities and ways that we could maybe improve some of these numbers.
So are there specific strategies going forward from that plan that, do you have that in your brain right now, or?
I do not. There are multiple strategies. There are 4 different work groups, and I'd be happy to share the community health improvement plan, and we update it annually.
Thank you.
Can I just add something from a parks perspective on that? So, considering that, a lot of people feel like there are options, but maybe they aren't actually getting out there and doing them. We've worked really hard to try to diversify our program offerings to try to meet people where they're at or offer different types of opportunities that maybe you feel like there are a lot of programs happening, but nothing's really resonating with you. We've worked really hard to increase the different types of programs, whether it's history, recreation, or wellness, to try to create an opportunity that maybe will resonate with someone that didn't resonate before.
Great, thanks.
Looking at that page 16 that talks about the rec passes that were provided. And so when I think about access to these services for individuals who are perhaps vulnerable adults or children, people that maybe don't have economic means, or maybe they're living with a disabling condition, and it looks like you've got 2021 here. I'm just wondering how these numbers compare to previous numbers. And then I'm seeing that our enrollments are pretty high for certain cities and not others. And so I'm wondering if you could speak to that a little bit. And also those renewals look like they are lower than the initial enrollments. And so can you talk about some of that outreach and engagement that you've done for those specific populations? And then how is that helping them connect?
Absolutely. Thank you for the question. So I do want to comment that these 2021 numbers are actually the only second year data point that we have for this specific fee assistance program. The Recreation Pass Plus is actually a improved version of a previous fee assistance program that was available within our parks. So this was introduced in first with Hennepin County residents in 2019. So relatively, this program has lower lower years of data to try to look at. And in Scott County, it even has 1 year less than that. So this is our second year. So when you can see the lower renewal numbers, that is the renewals from the very first year of this particular program being offered. But I do want to share that as a part of that, we are really excited to have this program, and we've been sharing this information, partnering with the Family Resource Centers in Scott County, having that as a standalone resource, and even doing park tabling hours to help people sign up for these programs. We do offer assistance for signing up for these programs at public events as well, that we've been out in the community. And then anytime we're sort of sharing information about our parks, we are offering this knowing that individuals or families experiencing financial difficulty. It might not always be evident when you're talking with groups, but making sure that people realize that this is an opportunity available kind of across the board. And one thing I do want to comment on for the data related to the cities, we have some of our parks are closer to some of these locations, and that may have a role in it due to, we know that transportation can be a barrier, and so maybe families that are experiencing hardship are really more likely to go to the places that are closer to their home. But this is not reflective of any of the township data. They are grouped based on larger city groups, and in the future we do want to have a more representative geographic data set of where within the county folks are signing up, and that will help inform our engagement in the future on what communities we may be doing a really great job at sharing this information, but then what communities we need to be reaching more thoroughly.
On page 13, you have the annual visits to the park system, and the 940,000 is a very impressive number when you look at the raw number. But the county population of roughly 150, it's about 6 trips per person. Yeah, I think my experience with the parks is there's frequent flyers. So there's a lot of repeat visitors here. Do you have any idea when you talked about the obesity rates, we're trending worse, we're going the wrong direction? Is there any data that kind of talks about the household? I mean, households have the habit, right? You eat healthy, you exercise, you get out. And so this kind of talks about the people that are going there, but how do you understand the household behavior, what households are doing the parks, because it's up, and you think that if the stuff was going up here, we would be trending better than the state on obesity, and yet they're kind of contradictory. And what does that data tell you?
Yeah, I don't think we have, and we'd have to probably do a bit of an analysis to really try to tease some of that out. I don't have it on the top of my head. Certainly the annual visits number, we don't have a lot of information about who that is. This is the type of survey where they're just counting bodies coming and going. But we can compare it with, so there's every 5 years the Metropolitan Council does a visitor study where they engage more with park visitors, and they learn more about what are they there doing, how long have they been there, how often do they come, and those results are not completely finished yet. So we should have those and that report out within the next, I would say, 3 to 6 months. And then our partner, Three Rivers Park District, also does a more in-depth visitor study every 5 years, and that's happening right now. So we'll have those results next fall. So I think, taking those things together, perhaps we could tease out or speculate on what households are doing. But this data set just doesn't tell us that. We would probably need to design a different type of survey to figure that out, or do a different type of engagement.
Yeah, because even the frequency, I probably average 200 trips a year minimum. Right. And so I skew those results. So if you take that, and there's a frequent flyers out there, I mean, I know all these people by name, the golf cart guy, and all these other people that I talk with when I'm out there. And so the concentration, there seems to be people that use it religiously. Right. And that means that not enough people are actually going to the parks, because at Visit, I think there's a lot of repeat people that live there.
Yeah. I know
Not
that,
literally.
I know that, yeah, right, let's hope not. I know that a lot of our repeat visitors are folks that go to our off-leash area at both Spring Lake and at Cleary, and a little bit at Murphy Hanrahan. I do want to point out that our golf visits are not included in this, and I think our golf visits are about 50,000 a year. And certainly there are quite a few repeat visits there. So I hear what you're saying, we just don't have the data to tie all that together.
So Patty, can I ask you about that? So what most of the data that you have available to you comes either through the Met Council or through Three Rivers. Is that right? And do you get what you need? Do you get it at a frequency you need? Like, I think about all the attention we're paying to how kids are doing in Scott County, and it would be great to be able to carve out, like, these are the programs for kids in Scott County. And it sounds like you don't have data down to that level at this point.
We don't. Alyssa and I are actually working on an initiative trying to analyze and make sense of and have it help us make meaningful recommendations for what we should be prioritizing funding in our work on. And we don't have that yet. So we want to look at, what programs is the county parks providing? Who else are providing programs? Who's good at what? And really make sense of what kind of an impact are we having on kids. In terms of data, more data would be great. It does come at a cost. The visitor study that the Park District does for us is at no cost. They do have a small research group that supports us. So what I would imagine one of the outcomes of some analyses that Alyssa's going to be putting together, we'll be reaching out to them and asking them their advice on if we want to understand these questions and we have this information available to us, how might we look at that? Is there data we need to go get? And that is a support that we get from them, and it's really, really helpful.
Okay.
Yeah. Did that answer your question, Chris?
It did. Thank you.
For the data that you do have available, I mean, there are some impressive trend lines here. What are you most proud of? What tells you that what you've been doing is working and we're having some successful progress? And maybe that answer is different from a public health perspective versus parks. But then also, what's most concerning or what's going to be most challenging for you coming up?
I think from the public health perspective, we're pretty proud of the increase in availability of fresh fruits and vegetables that we've had in the county. If you look at page 9 on the resident survey, we've gone from, in 2016 we're at 67%, and in 2022 we jumped to 82%. So we have done a lot of work on access issues and reducing barriers to fresh fruits and vegetables. A lot of that comes with work that we've done with community gardens and providing kind of, no pun intended, but seed money to a variety of different places to get their gardens started, and working with community partners such as the city of Shakopee, who just put in an edible landscape. So that's our first one in the county, and we hope to see more of those. City of Savage, we gave them some startup dollars, and they're putting in another community garden. So just lots of different opportunities, working with our VeggieRx program. So we really I believe that this data reflects a lot of that work that we have done to increase access to those that are low income and may not have access. And kind of on the flip side of it, if you look at consumption, our numbers are pretty good for consumption. So not only do we see increased access, we are doing better as far as fresh fruits and vegetable consumptions. We're doing better than the state and overall better than the U.S. there. So a lot of work has been done in that area, and I think it's paying off.
And just to add to that, Danielle, I think at the same time it does show a lot of our great work, and we've worked a lot with our emergency food programs as well to get Super Shelf, which is an initiative from the U of M, into our food emergency programming as well, where that is putting fresh produce right at the front and making that available in abundance to those participants using those spaces. And so helping them with that and connecting them also with doing produce drops and all that, and just increasing that has been a significant, I would say, work that we're doing in the background too.
So on you have the availability piece, and they call it fresh. So on page 10, you talk about the consumption. Is that fresh, or is that just fruits and vegetables in general?
The question that they ask, I believe, is servings of vegetables. So,
okay. So if the focus is on availability, and you're trying to educate the population and the people that are served, how do you round out the other 9 months of the year? I mean, what's the messaging? How do you address that? Because obviously, fresh is not going to be fresh outside growing season. No community gardens, winter. People hate winter, I hear, and so I love it. So how do you balance the other 9 months of the year? What's the messaging, the education on the other 9 months of the year?
Well, I think a lot of the work that we've done at the food shelf, what's open all year round, has been critical on that. Availability of fruits and vegetables and options right in the front end, and the food giveaway programs that we have been working with. Most of those options are healthy. So it is a variety of different key messages about eating a more balanced, healthier meal. In the summer, when we do our Veggie RX program, we do have information about canning and ways to continue to eat fresh fruits and vegetables recipes. So we do cooking matters classes. So there's a lot of different reinforcements to that message about eating healthy, eating those fresh fruits and vegetables.
Okay.
Can I follow up on that? So as I was reading the materials, there's really two things that seem like they're in transition with SHIP. One is you have a new grant. Yes, an updated grant. And second, that you have now have an open staff position. And I'm wondering, as you think about that and how you might use this program in the same way or in a different way, how does the position opening and the new grant criteria change your programs?
Well, a couple different things with the new grant round is that they have incorporated wellness activities, so more mental health. So we can do some more mental health activities that we're really excited about. We do know that more active living and wellness is connected with good mental health. So we'll be probably adding some more targeted programs there. The other piece with the current open position as we're looking at it, another thing that we're very proud of is the success that we've had with our partnerships in the community. In the past, or since we started, at least in the past 2 years, we've been working very closely with our partners to help them increase our sustainability. And we have worked with them and applied for almost $800,000 in grants for them. Either jointly because of SHIP, because of our partnership, we were able to access dollars that they may not have been able to access, as well as provide some good templates for them if they wanted to increase their grants. So we may utilize our newer position or parts of those positions to continue to work with the faith-based entities, the community-based entities, the cities, to leverage some of those grant dollars that are out there specifically for healthy eating and some in active living. I know some of them include like safe routes to school. I have a whole list. USDA grants, AARP grants, our META grant, that have been made possible because of our partnerships with SHIP. And it really is also to increase their capacity to have these programs and not rely on the county. So we're really just getting people in that mindset. And we should be able to do some more of that work with the new grant round.
Before we move on, because you referenced wellness and the mental health component, Alyssa, I'd like to bring up that other data slide right now to have you speak to that. JJ, could you bring up that wellness data for us? So could you just, this is a new initiative, could you just walk through the data on the slide and explain what we're looking at here and what are the key points that we want to take away from this?
Absolutely. So this is data reflecting a relatively new Parks Wellness initiative. This initiative is grant funded. The grant funding was received in July 2021 and ends in June 2024. So this kind of infographic just highlights some of the success that we've had so far. The idea of our wellness initiative is to provide low impact, beginner friendly, wellness themed programs in our parks. Touching on the point that I mentioned earlier, that we are trying to diversify our program offerings and provide more opportunities for people to visit our parks and find a place for them in our parks. So we did start offering programs in April, and so that is why this graphic does highlight starting in April, and this just shows our program attendance starting at that point and kind of where we've gone throughout the summer. And then some other aspects they were highlighting. So all of these data points are data points that we identified in our grant application that we would track. Some are newer ones, including our wellness newsletter. We do have a Parks Wellness programmer as a part of this grant that we received from the Metropolitan Council. And she's done a really amazing job at creating a wellness newsletter every month. And since the beginning of that newsletter in April, we have over 100 people receiving it every month, which we're really excited about. And then other metrics that are shown on this graphic include our general percentage of partner programs, because while we are offering these programs publicly, we really wanted to prioritize that we are meeting our communities where they're at and working with our community partners to be providing programs that are wellness focused, that are interesting to them, and also working with them to promote the sustainability of these types of programs and having wellness skills for being outside. And then we do offer feedback surveys from individuals that have completed our program. So those are the metrics that have been highlighted on this. But in general, this initiative is a pilot. Like, we really are, as I mentioned, we started offering these programs in April, and we're really working on trying to find the communities that are interested in this and make sure that we're just providing skills for these communities to accept the values of being outside. You know, if they're interested, learn how to gain new skills to promote being outside. And when you're outside, and it helps impact your mental health, but can also, if you're on a walk, that might be helping your mental health. You're also improving your physical activity and maybe gaining more confidence to use the parks in other ways in the future.
In lieu of that, one of your slides on page 15, you talk about the number of people participating in recreation programs. Obviously, there was a dip in 2020, which we all know why, but it is coming back up. You do mention in this slide that you're wanting to continue to increase recreation programs, but that you do have some barriers or concerns about additional staffing and resources being needed. Can you talk a little bit about the programs that you would like to implement and some of those barriers that you see getting in the way of doing that?
So part of the wellness program initiative that Alyssa's doing such a fantastic working on, and then we've introduced some history type programs with our partner at Three Rivers. So part of doing this is to figure out what's going to resonate in the community, especially when it comes to new people coming to our parks. And then that will inform sort of what we should be doing in the future. And I'll reference back to when I said that we're going to be working on an analysis of what impact are we having right now? How could we have an impact? Who else is doing what? That all needs to come together before I could come and make a recommendation to leadership on what we should be doing. So there's some pieces we need to put together to make sure we believe in what we're asking for, or what we might be asking for. Yeah. And it could be that we come back and we say we think that we just need to work more supporting our community partners who are also offering programs. We really want to be open to what that next step might look like, and we want to update it to support our recommendation.
I wonder if you can speak a little bit about sustainability planning. So I think we've heard you speak multiple times about providing seed money and applying for grants, and I think that's important to note that a lot of this work is happening not with taxpayer dollars, that it's happening with grant funding. And we know that there has been an influx of short-term funding that has maybe come to communities to help start up programs. But how do you see these continuing on? So even if I look at page 11 and we're talking about community garden beds, we set these up, and then what happens after those grant dollars go away? And I'm sure that's one tiny example in all of the programs that you're funding, but just curious if you can speak to that sustainability planning.
Well, I think on the SHIP side, we're always talking to partners about what does that sustainability plan look like? How are we going to kind of phase out in our funding with them? And then how we can help them with where they need funding to partner them with like other organizations or businesses within the community as well to help with some of those things as well.
And part of when they do apply for funding for SHIP, they are required to put up a 10% match, so they have some skin in the game. And a lot of what we do in SHIP is policy systems environment. So for example, in one of the elementary schools, we were able to fund a large salad bar for them, so they have more opportunities to offer fresh fruits and vegetables. So those are pieces that are now there permanently. But we do discuss with them sustainability planning, working with them now more on having them look and seek for additional dollars and grants to enhance their programs, but more and more are doing that. So that has been very positive.
And then just to touch on the sustainability from the wellness grant that we're working on, as I mentioned, these programs are really designed to be beginner friendly, low impact. programs, and they're really geared around skill building. So all of these programs that we're doing are not necessarily to be, this is the only way that you could do wellness in the parks, but let us show you how to utilize or do these types of activities so you can come on your own time, whether it's to our parks or in open space in general. And that's an approach that across our programs, there's definitely across not just wellness, but in our recreation programs as well. It's very much like, let's learn a skill together so that you can come out and improve or increase your activity in the parks on your own terms. But I did mention that the wellness initiative, there's a lot of partnership with it. And not only are we really trying to provide these programs for our partners that are really serving communities that may really enjoy or would like to utilize these types of skills or these opportunities in our parks, but we're hoping that the partnerships not only strengthen our current community partnerships, but we also hope to gain new partners, and that lives on beyond this wellness initiative. That extends into our planning, into our general engagement, into supporting our communities with spaces or other future events. So I think in that way, we're using these wellness programs as a tool to not only help people get outside and learn new skills, but also to help us become better partners within our community and just really build that authentic relationship that lives on in other ways throughout our regional parks and trails.
Not really pertaining to the slide, but you made a comment that winter is not people's favorite time of the year, and active, healthy lifestyle really is a habit. It's a 12-month habit. And whenever I break a habit, I have a hard time starting up again. So what type of things are you looking at to try and get people to enjoy the winter activities, to get them engaged so it becomes your own habit, they don't break their habit, and go 6 months doing nothing and start maybe midsummer? How do you keep them engaged throughout the year? What type of things are you looking at?
Do you want to talk a little bit about Annie's,
Yes.
her plans for the cross-country skiing?
Yeah, so, I mentioned that we do have a parks wellness programmer, and she actually is working towards her master's in social work and has a psychology background. And her and I have been having discussions about exactly what you were saying. Everyone is really interested in maybe trying out a wellness program in the summer, as an example. But when it comes to the winter, if you're already experiencing barriers, what makes you want to do that? And so we are trying creative ways to try to make the outdoors more inviting, having seminars on how to appropriately dress so that you feel comfortable, having seminars about, ways that you can enjoy being outside or keep your mind going or experiencing the new aspects of the changing season, and how there's a lot of mental health benefits for that and wellness benefits for that. So we are, from the wellness perspective, working on changing our programming to try to, have ways to help people get that push into winter and feel like they can be comfortable in it, but also working with our community partners and trying to do more social type activities where maybe it's a bonfire with one of our community partners that is also focused on doing a wellness walk in the winter. So you're getting a little bit of this is not just me going outside and being cold, but it's also, you're there to community build and to spend time with your family, and trying to incorporate both of those because mental, physical, and social health are all really so integrated. It seems like a win-win. So we're excited to try that out this winter. But we do also offer winter recreation programs as well that we know people love.
So just as a follow-up, we don't run inside. We're the parks people keep doing the programs outside, and I'm excited to see what the wellness initiative can do with our existing programs, and then, like Alyssa said, adding some things throughout the winter. I think there's a really great opportunity there.
So another aspect of people and enjoying the outside winter, you talk about dressing appropriately, and you may have people that are kind of falling in hard times and may not have the proper. Have you thought about in doing this kind of stuff? Whether it be a clothing job or something, that if people's barrier is the winter clothing, how do you take that barrier away to make sure they're doing the outside activity? Because it's a different way to look at it, but how do you make sure they're properly clothed so they can enjoy the outside?
Sure, there's one thing that you can tell people what to wear, but then if there's a barrier to them accessing that, some of our partners in the regional system have had fairs where they fundraise for offering winter clothing, and I'm sure that's something that Annie and Alyssa, if they haven't already talked about it, could talk about it for this winter. So they did do a fair in August at Cleary, where you brought partners together to talk about wellness and mental health in parks, and that would be something that they could certainly do related to how to properly dress and how to get access to those materials. Yeah.
There are a couple programs in the county that offer winter clothing, including with in some that are in the food shelves. Jordan has some clothing. St. Francis has a coat drive. SCA has winter clothes available. So there's a variety of different programs that we let people know about. But I just wanted to add about the winter. Right now we're in a unique situation. Normally we have people are going inside for the winter, but we don't quite know yet the full impact of COVID because COVID drove people inside, particularly seniors. There's a lot of social isolation related to COVID. So it's a lot of what we are going to need to do. But one of our challenges, and we are very concerned about, how do we re-engage those folks in active, healthy lifestyles? If they haven't even left their home for 2.5 years, that really is a concern that we have right now. We did some partnering with the libraries over the winter with our Cozy Up winter home activities for senior adults. We mailed out packages to kind of target well-being and social isolation and mental health, but we still have a long ways to go, and we just don't know the full impact yet. It'll take us a long time to recover from COVID.
I have one last question. I just wanted to look down the table and see if anyone has any last piece that you'd like to ask.
Yeah, well, on the annual visit by Park and Trail, when you're looking at trying to provide the opportunities and you look at financial investments in parks, how do you use this data? You invest in parks. Do you build out the parks that are really popular or give them more stuff? Do you look at the parks that don't have a whole lot? How do you make the financial investment decisions? Which parks you invest in and why, based on the visitorship to achieve the participation you want?
Sure. Well, we do a lot of long-range planning. So the last time we went through a comp plan and worked with the Parks Advisory Commission and, of course, the county board and got input from the public, there was quite a bit of conversation about bringing more facilities to the west and south, southern areas of the county. So we know that in the northeast part of the county, they have a healthy access to regional parks and trails. Both in Scott County and Dakota County. So really we do that long range planning and we're continually analyzing what's available, what hiking trails, what paved trails, where can we add those things. And we have our park system plan and our master plans that really guide that. And then we have a continual conversation with the leadership at the county and the county board to figure out where does that investment next go. So for instance, we have some investment planned at Cedar Lake Farm, and that really helps support bringing more of those amenities to southern Scott County, which doesn't have as much.
And not an additional question, but just a plug for residents that might be experiencing homelessness or housing insecurity and need to connect to some of those resources. We do have an event next Wednesday, the 28th, at Canterbury Project Community Connect, and everyone is welcome to step down.
Thank you, Danielle. I just wanted to ask, in the narrative, there's one barrier listed about transportation. It says some transportation barriers to resources. I'm not sure if that was in the parks area or access to healthy foods, but is there an opportunity to partner with our transit staff in a different way to help resolve some of the barriers people have to accessing parks?
You know, I will say with the access to food, a lot of our emergency food programs have been actually partnering with Hopscotch and using that program to bring food and that to residents who have a barrier to getting to it. Belle Plaine specifically has been doing lots of work with Hopscotch and getting that food out to people who have a barrier to getting to Belle Plaine food shelf.
Nice, thanks.
I also want to comment on part of our grant funding for the Wellness Initiative is to help with transportation support. And that's something that we know that our regional parks, they're not as ubiquitous across the county as like city parks might be, or community parks are just open green space. And as a part of this, and in working with our community partners, we are really looking at how we can help improve and reduce those transportation barriers. And so that money is included to help try to get residents or groups that are interested that don't know how to get there, can't get there, to help them get there.
Do you see opportunity working with our transit staff, Alyssa?
Yeah, we've had conversations with them. It's difficult to connect with the resident for programs. It's a little bit difficult because maybe a program is an hour and a half, and working with the schedule of, the programs are set at a certain time, and working with the schedule of a potential family, and then also connecting with transit. So we are working through trying to solve those. But from a larger event standpoint, maybe moving a larger group at a time, that's definitely a situation where we see that we could get some, have, some partnership between the transit and us.
Sure. Thank you.
On a related topic, I just want to give a shout out to the CAP agency. During COVID, they have been instrumental in delivering food, medications out to our community for those that either didn't have transportation or we didn't want them to go out to the grocery store. And now that we've also have been utilizing them during with a monkeypox case. So they have been an instrumental partner in getting some of those essential services by doing deliveries right to the door. So it's been wonderful to partner with them.
All right, thank you. Mr. Chairman, I think I will turn it over to you.
Thank you. I'm sure the board has a few questions or observations, comments. Thank you for the presentation. Colleagues, before I have a couple, let's start with you guys. Commissioner Ulrich.
Okay, I've got about 4 items. Excuse me. RecPass Plus, I Googled it, and what it shows on Google is it's available to Hennepin County residents. And then I clicked it, and then it says it's available to Hennepin County residents. If you go one click deeper, it says Hennepin and Scott. I would recommend changing it so the first thing they see on Google, it's available to Hennepin and Scott. And on the first page, you refer to it on the website, add Scott in there, because 3 clicks is a lot to find out you might be turned away by what you see before that. That's just a recommendation. So if there's barriers to people using programs, if they don't have winter clothes or something they need, I'm hoping you'll post those kinds of things to Fish, because it's just right in their sweet spot of things they can meet. The question was raised, how do we know what to do? How what to add or what program or what facility or what amenity? That's the beauty of us being linked with Three Rivers is they have many, many parks and a lot of experience over many, many years, so we can draw on that. And we can know what is the desirability likely to be, or like camper cabins or frisbee golf or whatever, lighted cross-country skiing or whatever it would be, because they have that stuff, and that helps us, right? Doesn't it?
Absolutely, yes, thank you.
Yeah. Now, one other thing, Met Council in the past had an equity program where they would make some equity funding to parks, and I always struggled with what does that mean and how would could that ever be used? Well, it just occurs to me that maybe there's a way to get some funding for a hopscotch program and have a little more dedicated to the hopscotch, have some where if you need a ride to the parks, hopscotch can pick you up, and then maybe there's a funding stream from. I don't know if that Met Council equity thing is still going, but that seems to me like to be a viable possibility. That's just, those are my questions or comments.
Mr. Chair and Commissioners, did you want me to, I have a comment back about the Met Council Equity Program. Do you want me to share that now?
Please, that'll be a subject I think we're all interested in.
Okay. The equity funding is a competitive grant process through Met Council Parks now, and that's the program that Alyssa applied for the Wellness Initiative and received that grant. We also got a grant. Were we the only agency that got 2 grants this year, or that year? No. Okay, sorry. But one of our grants was the highest rated of all of them. We received an equity grant to improve our shore access at Cedar Lake Farm for fishing opportunities. Our partner Three Rivers tried to submit a transportation grant to that program to address exactly what you mentioned, and nothing came of it. And it's something that I think all the agencies would be interested in. They do allow if multiple agencies to work together on a grant program, and some of us have talked about whether we should get together and strategize a joint transportation grant. It's pretty complex. This doesn't mean it can't be done, but so there have been conversations. The one grant that was submitted by the Park District was not supported. That's my understanding.
Commissioner? That it? Good.
That's it. Thank you.
Okay. Other questions, comments? Commissioner Brecky.
Thank you. Thanks for the presentation. I just want to comment on a couple things I heard that I really was happy to hear. We get all this data. We need the data. We keep striving for more data. But Patty, I really liked how you talked about the cost benefit data too, and we need to keep that in mind sometimes when we're, I'd love to know exactly how many people are using our parks, how many times, and that would be helpful, but only if it doesn't cost us too much to get that data. And then I also really, I think both Haley and Alyssa talked about the community partners, and especially with parks and wellness and all of this, it's really important we don't isolate, because even on access to parks, I mean, maybe access to some of our parks is going to be harder. They're community regional parks, but if there's a park within a mile of a person's house and that kind of access, and that's a city park, that's great. I mean, that's what we care about. We shouldn't be into a territorial thing, we want more people to use our parks. We do, but we want them to be healthy and active, and that's the prime concern. Good comment, Commissioner Ulrich, on clothing with fish, and Lisa with all the options out there. I think it's really important not to create something new when we have probably 42 different winter clothing drives in the county almost, and some accesses. And then finally, the only thing that, and maybe I missed it, but I think it'd just be really important to connect with Commissioner Beard's favorite county program with Master Gardeners, because they are doing, I know you work with them somewhat, but I just want to make sure their data is included in here with the community gardens they're supporting, that I know some of them are connected with the SHIP grant, but in some of the educational programs they're doing on this same topic with folks around the county, public, JAF, all that. So just a connection that I think maybe they should be included in this. So, thank you.
Okay, thank you. Anyone else? Commissioner Beer.
Thank you very much. My first question is, why was there a bathroom scale on my seat with the readout on my Zoom screen? Is that? And then the second indicator was adult obesity rate. Is there a correlation that anyway? So question on the park pass, and Commissioner Breck kind of brought it up as well. So when I look at the park pass, we're actually on that one. Prior Lake, Shakopee have the most, obviously it makes sense, biggest cities, but I'm embarrassed to say how short of a walk I took yesterday, but I was trying to fit it in between a couple meetings, and I took a short walk, and I did walk by no less than three city parks that were all pretty awesome. So I too want to just make sure that when we're looking at data, I mean, our parks, our regional parks, golly, they're money. I mean, they are crown jewels. I know where they're at. I have cars for days. I've got a bike, I think. I don't go. I'm busy. There's a lot of reasons why I don't go. So I just want to make sure that we're looking at it through the lens of, yes, we do have these amazing parks, and they are. But man, some of these city parks are unbelievable. Lions Park and Chaco, Lakefront and PL. So I just want to make sure that I know we're in the county park regional lens, but we're also part of a bigger picture. We talk about partners, so just making sure that when we're looking at data, and I know sometimes that makes it a little bit harder to different jurisdiction, but I think that's an important piece that could be why maybe our park usage isn't as high, or I think it is pretty high, but so that doesn't necessarily mean that there's no access. It's closer, and it makes more sense. So, and then I guess I had one question on the page 3, the what's not working well. Transportation has been brought up, and so that sort of plays into the possible city parks. But what is our goal? So it says, transportation barriers for some to get to local resources. Well, what's local? Is that our parks, city parks? Like, what's our goal? When we say that's an issue, how do we know when it's not an issue? And we don't necessarily need that today, but if we have this, it's an issue. Well, when do we know when it wouldn't be? Or is it just kind of one of those standing things?
I mean, I think our goal is to ensure that everybody has access. Everybody that wants access has access, and that there are no barriers. So I'm not sure when we'll know when we get there, to be honest.
Well, and it's one of those things, and again, I'm pro parks and all those things, but I sometimes wonder, and not just in this program, but sometimes, man, we got water all over the place. Like, metaphorically, you can lead a horse, but I mean, so just to be cognizant of that. With SHIP, because I saw that was mentioned in here, we got some nice logos on the back. SHIP is that 100% grant funded? or mostly, but we all pay Minnesota income tax, so it's still income tax. Is the basic health and nutrition, and this is not meant to be a funny question, is that still taught in schools today, and do we work with those schools and those partnerships? It's been a while since I've been back in those days, but do we work so that's part of a curriculum that kids, we want to catch people early, so in their kids, adolescent, is that taught, and are we a part of that or not with the schools?
We are a part of that with the schools. We are partnered with all of our public schools in the county, and we work on that in different ways with them. That is doing like active classrooms. That's helping them with like how their lunchroom is looked and marketed and food and what's available. As Lisa mentioned, putting a salad bar in and those types of things, and working with them on evidence-based curriculums being a part of their what they're teaching. So we do a lot with our schools, but we do let our schools lead the way, I would say, in what they are prioritizing as well. Like with the Shakopee School District, we just, the resilient path that you'll see on the handout in the back here, we did have the CAP students duplicate that into the Shakopee High School as well. And so it just is really led by them on what their priorities are in that space, but we do partner with all of them in different ways.
But the gist is they too have their own curriculum. We're just kind of complementing what they're already doing. We are not their nutrition experts, and that's all they're going to get. Yeah,
correct.
Okay.
So we're working with their food service or their teachers to enhance probably enhance their curriculum or change some of their curriculum where it's going to be embedded into the school culture though too. So that way it's sustainable.
I figured we did, but I didn't want to wonder. I wanted to ask since we had the experts right here. So that's my comments. Thank you.
Okay, thank you for that, commissioners. I just have one on page 5 when it comes to access to physical activity. Why isn't that 100%? Or is the differentiation here that this only is access to county facilities that could give them physical activity?
I'm not as familiar with this data, sorry. So
And I noticed this is Robert Wood Johnson's foundation did this. Maybe you don't know the methodology.
Commissioner, sorry, Lisa. Commissioner, it has to do with how many miles you live from a health club or a park.
Okay.
And so if you live, 5.2 miles instead of 5 miles, you're going to be in the miss category. So it's a
that's
mileage
what they're
calculation.
Considering, okay. Yeah, because I think exercise, physical activity opportunities are all around us. I mean, take the stairs instead of the elevator, park 2 blocks away and walk to work, things like that. Mm-hmm. Even if we don't have a county park down the street, it's okay. But they've got a methodology they're using, and that's where they come up with this.
Yes, sir.
Okay, that
Can I just ask,
Commissioner
Mr. Chair,
Wolf.
Chris, is the number 5 miles?
No,
You just threw that out.
I just threw that out, I'm sorry.
Okay. All right.
For instance.
Because I think everyone's within 5 miles of a club.
Yeah, well, it's a for instance.
Anyhow, okay.
We'll cut them a little slack on that one. Lisa, you wanted to.
I was going to say, Commissioner Beard, I can certainly send you the indicators and how they're calculated from the Robert Wood
They
Johnson.
do.
I believe the sidewalks in the community are also are included in that. And,
Yeah. Okay.
proximity, bike lanes. There's a variety of different metrics that are included in that, and I can certainly send that to you.
Because to me, a lot of this is personal initiative. Maybe that should be one of our focus points, is helping people think about their health and think about what they can do to take care of themselves instead of having to build another mile of trail for $80,000 a mile or something, when they can do that on their own street, walking the dog or whatever. Enough about that. Thank you for the presentation and for ensuring Scott County has an outstanding systems of parks that everybody can get to. And again, I look at that thing, it should be 100%, but I understand that there's a methodology they're using. So